Hello, everyone. Thank you so much for joining us to the Ask the Doctor series. My name is Juliana Day, and I'm the founder and president of Life Decisions. I'm your host this evening. You can find us at lifedecisions.me, as well as some of the previous podcasts under the Ask the Doctors tab. This evening, I have with me Dr. Tom Perel, president of Democrats for Life, and Dr. Catherine Wikler, a board-certified OBGYN physician. Both are members of A-Blog. In addition, we have two important guests, and I will introduce shortly. Thank you so much for sharing, everyone, their expertise with us. The issue of abortion is critical. At Life Decisions, we encourage an open discussion, and also we tell people to share their life experiences on this issue. We live in post-Roe America. With that, there's been some challenges. One example is the recent Kate Cox case, the Kate Cox case. So, Dr. Tom Perel, could you please explain the lawsuit the Center for Reproductive Rights filed on behalf of Kate Cox?
Yes, thank you, Juliana. Kate Cox is a 31-year-old woman who lives in Texas with her husband and two healthy children from two previous C-sections. And she became pregnant in August of this year. And as per the routine, at 10 weeks, she had a blood test which looks for fetal DNA and can detect not only the sex of the child, but in this case, she was having a daughter, but also can determine whether there's any chromosomal abnormalities with a reasonable degree of certainty. And in this case, she got a call from her OBGYN who told her that there was a reasonable probability that she had a condition called Trisomy 18 in her developing fetus. As a result of that, she had additional testing at the appropriate time, which she had amniocentesis to confirm the suspicion. And in fact, it eventually came back confirming Trisomy 18, which, and in this case, it was called full Trisomy 18, meaning there was not any normal mosaic pattern to the inheritance in the fetus. And so she was told, based on her reporting and based on her own op-ed in the Dallas Morning News, as well as an appearance on the New York Times Daily podcast, that her child would likely suffer, would have a very limited time span, within minutes to at most a week if she was not stillborn prior to birth. And she was likely, based on serial ultrasound studies, had significant anomalies in conjunction with the trisomy 18 affecting her heart, her spine, potentially spinal cord, and as well as a hernia in the abdomen of the fetus. And so she was painted a pretty bleak picture. What she was told, at least according to her, was that, some women choose to carry the baby to term, but others choose to have an abortion in circumstances like this. And they advised her that because she had two previous C-sections, that her risk from a third C-section, if she decided to continue the pregnancy, would pose some additional risks for a fourth pregnancy down the road, which was her intent. And so given those circumstances and the fact that she had read about a similar case that was pending before the Texas Supreme Court, she reached out to the Center for Reproductive Rights, who took her case to the court. And they filed on behalf of her husband, and the abortion provider that she identified. The abortion provider had told her also most of the consequences, but didn't, and suggested that abortion was a safe approach for her, which a so-called D&E abortion, which is typically done at 20 weeks, is where she was at the time of her meeting the abortionist. And the D&E procedure, just for those who aren't familiar, involves dilation of the cervix, which is the entrance to the uterus, and then the fetus is grasped and dismembered, and eventually the skull is crushed and the remaining tissue is removed. In a survey throughout the United States for people that perform later abortions, only about 50% kill the fetus before this dismemberment, which means that at the time of the abortion procedure, the baby is fully alive, fully aware, fully capable of feeling the pain of the dismemberment procedure. That was not discussed with Kate. And also the fact that the risks of abortion increased substantially over the course of gestation was not discussed with Kate based on her interviews and her own opinion piece. So she was under the impression that abortion had very little risk, even though for each additional week of gestation, after 8 weeks, the risk of dying from an abortion goes up by 38%. And she was also not told that because of her, she was only told that because of her C-sections, she was a risk for delivering her trisomy 18 child, but she wasn't told because of her C-sections that she was risk of having an abortion procedure as well. When you administer a agent to contract the uterus in conjunction with the DNA procedure, that puts her at increased risk of uterine rupture, which is something that they had mentioned in conjunction with the possibility of a future pregnancy and C-sections. So there's a lot of information that wasn't given to her. And the other thing that was striking when she talked about her situation is it wasn't clear that she was referred to an organization of families that had trisomy 18 children to be aware of what it entailed, to have some sort of sense of families who might have dealt with it. And she also wasn't told about, at least from her description, about perinatal hospice as an option. And so those are some critical things that certainly could influence how she received information that she had regarding her child and why she chose the path that she did.
Dr. Wikler, could you walk us through the obstetric issues raised by the Kate Cox case and trisomy 18? What was omitted? I know Dr. Perel already talked a little bit about that, or glossed over by the lawsuit and the ensuing media coverage.
Yes, thank you. So I'll start with what trisomy 18 is. It's also called Edwards syndrome. And as Dr. Perel mentioned, it's a chromosomal disorder. It happens by either the sperm or the egg having an extra chromosome typically. And we're speaking about chromosome number 18. So each one of us has 23 sets or pairs of chromosomes, one from each parent. So this child would have that plus an additional, usually whole extra chromosome 18, that's called complete, sometimes just a fragment of 18. These children all have significant intellectual impairment. They all have significant motor impairment. But what I want to point out is actually that there's a huge variance, though, in what this looks like in each one of these kids. The third thing is that they all have some kind of birth defects or anomalies associated with it. And there's over 120 described in the literature. They don't have all of them. So each child is unique. And what the child looks like on ultrasound does not predict the lifespan of that child, whether they will live until term and through delivery and to 1 year. This is basically the baby writes its own story. That's the truth of this. So even the severity of the anomaly doesn't tell you what this child is going to be like. So I think that's one important thing. What we heard from her story is that she was told she was, if the baby survived, that she was going to watch the baby have a painful death sometime within minutes, hours, or at the most a week after birth. And I'm going to talk about that a little bit more in a minute. So the birth defects these kids have, I'm going to focus on 3 that are the most significant, that are the ones that most commonly cause early death in these babies. The first one is heart defects. And somewhere around 90% of these children will have a heart defect. And interestingly, if the baby didn't have trisomy 18, the majority of these, we would offer surgery and medical management, which would greatly increase survival. But historically, these babies have not been offered that most of the time. The second thing is something called apnea. Apnea means that the baby can't breathe normally. And what we used to believe is because of some kind of central or brain defect. and wasn't treatable. But what we have learned is that actually most of the time it's from malformation in the way the mouth, the airways, the jaws formed, and a large number of these babies, instead of the obstruction when these airways won't stay open, if you surgically manage it, actually their survival rate goes up huge. And the third major thing that the kids face right after birth is a lung issue commonly. A lot of times their lungs don't fully develop, or they have something called pulmonary hypertension, which is essentially high blood pressure within the blood vessels in the lung, which is a serious condition. So what we have found is that longevity is variable, not predictable, and we're going to hear some of that when Beverly, one of our guests, tells her story. So traditionally in the United States, we would tell you that 40 to 60% of these babies are going to actually not survive pregnancy, or called a stillbirth, or not survive the delivery process. And of the babies that survive, which is 40 to 60% also, that their median survival is only 3 to 14 days. And by 1 week, their survival was traditionally 40 to 60%. And at 1 month, 20 to 40%, and at 1 year, only 5 to 10%. So we would tell people this is a lethal diagnosis in the past. However, in places like Japan and in Korea, it was illegal to have an abortion for a fetal anomaly up until 2019. So we started to see studies coming out of these places where they started, instead of just offering comfort care, they started actually actively managing and sometimes doing surgery on these babies like we would on other babies. And their survival rates were changed. So in Japan, one study, they initially had a 34% survival rate at 1 year, which is about triple what ours was. And after starting to actively treat these kids, it went up to about 60%, more recently 70% survival at a year. In Korea, somewhere around 70%. And there's now a research center, University of Michigan, where they have an ear, nose, and throat doctor who specializes in surgery on kids like these. And their survival rates have been up to 90% in a year. So what we're finding is that we should be calling these life-limiting diagnoses. Do they have a normal lifespan like you and I might? No, but some of these kids are living into their teens. So we now should be calling this a life-limiting diagnosis. And interestingly, the primary factors on whether these kids who are born alive survive is whether or not they're offered heart surgery, whether they're offered treatment and surgery for their apnea. And the third thing is whether they get active medical support. And interestingly, there was this one study of this consortium of newborn ICUs in the United States, and they divided kids into the ones who had surgery, the ones who were offered newborn ICU treatments, and the ones who received comfort care. And they found that the ones, you would think the ones with active treatment would do better, but what they found is their survival rate was lower. But when you looked, it was because they withdrew the care. So if you give the care, their survival rates are really quite significant. So I don't want to minimize that these kids have complex medical needs. And Beverly is going to tell you about that. But what we see in study after study, and this has been my experience as an OB-GYN for over 24 years when I practiced and through friends, is that these kids actually are happy most of the time. They add a lot of positive to their family. They have very valuable lives. In fact, most of the families describe them as having a high quality of life. One of my friends from college has a child with trisomy 18, who last time I saw her was 16 years old. And she said, I can't imagine life without Martha. Our family would not be the same. So that's one thing. I think the other thing is, I don't want to minimize that some of these babies do die before the birth, and some of them die after birth. And what you need to know is that these kids are not suffering in utero, that for children really who are not going to survive, we're going to have Deanne, our other guest, is going to talk about what does perinatal hospice or comfort care look like. So that is something that some of these people face. I think the biggest fear is watching a child suffer. And not necessarily, and I think both of our guests will talk to this, these kids have an important life. To honor them, give them dignity of life, give life-affirming care, and allow families to be a family and have this very precious time with this child is critical. And I can't wait to hear what our guests have to say about that.
Oh, absolutely. With us, we have Beverly Jacobson. So welcome. A little bit about Beverly. She is an Air Force wife, homeschooling mother of 9 children, and well, 9 children on earth and 2 in heaven. While pregnant with their is their youngest, Beverly and her husband learned that their 9th baby had Edwards syndrome or trisomy 18. Verity is approaching her 7th birthday, thriving with a condition some in the medical field still label as incompatible with life. Their experience led Beverly to start a nonprofit, Veritas Village, which helps families who receive a prenatal diagnosis. She's an author and a speaker in the pro-life and homeschooling communities, encouraging other parents with a hope and peace found in Christ. Welcome, Beverly.
Thank you so much. It's good to be here.
So maybe
Yeah.
you can share your story with us and tell us what it was like to get the phone call from the doctor about your baby's prenatal diagnosis.
Sure. Thank you for having me. And Dr. Wheeler, it was listening to you. A lot of the words that you were saying are actually what I heard for the first time when I got that phone call. I was 18 weeks pregnant with our little girl, who is number 9. She is our youngest. And I'll be honest, I was going through my own journey of, I thought we were finished with 8 and here we were pregnant again. And so I had just, kind of dealt with that. I'm a busy homeschooling mama and I just, felt a little overwhelmed. So when I got this phone call that I was not expecting, we were about to start a homeschool day and all of my children were in the kitchen. We, had just had our breakfast and I stepped into the other room because I knew it was a doctor and I don't usually get phone calls during my pregnancies. So when she told me that my blood test was showing an elevated risk for me to have a child with trisomy 18, I had never heard of that before. And I was just stunned, asking her, well, what does this mean if I do? And she really tried to downplay that it would happen because she said, oh, well, it's only a 1 in 10 risk. And we're going to schedule a diagnostic ultrasound and everything's probably fine. But I pressed her and I said, what if? I mean, that's still a fairly high percentage. And she just got really quiet and said, well, children who have this condition usually don't make it to birth. And if they do, their life will be very short and very, very difficult. There would be severe anomalies, severe difficulties is what I remember the impression being. And so I hung up and just cried. My kids were right there. I couldn't hide it from them. We were very open about our life and our faith. And we just right away said, I remember saying, whatever happens, we know that God is good and God is sovereign and he has a plan for this baby and we'll get all the information we can and take it from there. So we spent a few days just having to sit on this and wait until we had that appointment with the genetic counselor who told us what they would be looking for and why they thought it was trisomy 18 and not 21 or any other condition. And I remember in the room with the ultrasound technician, it was very quiet. It was peaceful. We had prayed, but it was pretty clear. We could see her little clenched fists. She didn't wave at us, the hi mom picture that so many of our other babies gave us. She had clubbed feet. She had cysts on her brain, soft markers that indicated she probably did have trisomy 18, but we did go ahead and do an amniocentesis just to be sure. And we just knew even before the results came in. So the rest of the pregnancy really was a processing of all of this. We went into our appointment with the genetic counselor saying abortion is not an option for us. We love this child, and whatever happens, we just want to be prepared to know, how best to move forward. And she was very kind, and I think she was trying to be as objective as possible. So for us, it was a mostly positive experience in her office, because she was just saying she was there to give us information and not tell us what to do. Now that I have worked with many, many families who have walked through this, I know that that is not necessarily always what happens. There's a lot of prescriptive language of what should happen or what is assumed will happen after a diagnosis like this, but we did not have that ourselves. We did have a couple of doctors who did use some negative language, one who clearly seemed to indicate that she felt the right decision would be to terminate, even though we had said this was not on the table for us. But by and large, we did receive a lot of support from our military doctors, where I was at the time at a military treatment facility. And then when I transferred over to the high risk in Omaha at the University Medical Center, where we later delivered her, our church family was very supportive. Our families were supportive. We had all kinds of support. And I know that is not the story for many families out there. So we progressed through the pregnancy. I did not have complications myself. It was a pregnancy for a 42-year-old woman. I mean, I've had a lot of babies. I've had a lot of swelling and a lot of discomfort, but there was nothing unique as far as her diagnosis affecting me. And I did end up having a vaginal delivery at 40 weeks and 3 days. And I believe the fact that the doctor who delivered her was on board with not inducing, with allowing me to go as long as possible. He did say if we got to 41 weeks, we would revisit that conversation, but he was not pushing me to induce. He was willing to see what happened. And I was prepared for a C-section if it meant that we would meet her alive. However, we thankfully didn't need to do that. And she was tiny, even though, she was full term. She was 5 pounds, 3 ounces, and came out, and I got to have her on my chest for a few minutes before she started turning gray. And it was clear she needed some support. So then they whisked her away to the NICU, where we stayed for 18 days. Now, our ultrasounds, which we had many of, did not show us that she did have heart defects. So we thought that everything was fine in that respect. We really had assumed if something were wrong, that we would see that. We did not have any fetal echoes or anything. But the day she was born, we had asked for an echocardiogram, and we learned that she did indeed have 3 VSDs. And those are holes in the lower chamber of the heart. And one of them was in a location and of a size that they had said she was going to need heart surgery to survive before she turned 1. That was a lot to take in on the day of her birth, but the care team there was just phenomenal. They really supported us, it walked us through, gave us so much information, and answered our questions. And I will say that Verity is almost 7 years old, and by God's grace, she has not had heart surgery the way we thought she would need. They took her case before the cardiologist team about 2 weeks later, and they asked if they could do a repeat echo because they wanted an up-to-date one, and actually came back and said, we need to do that again. And I was really nervous, but they wanted to do it again because they said it looked like the hole was patching over on its own. And in fact, that is what happened. So she has been monitored, but she has never had heart surgery. So that is, again, I feel that it's a miracle. I have heard of other cases like that. We know many children who have had life-saving intervention like that. Our story was different. And it does make me wonder how many of us walk around with holes in our heart and we just don't know because we're not monitoring it the way we do with these little ones. But she does have other issues. She does have apnea. We are thankful she has CPAP. So when she sleeps, she can sleep safely. There were a number of other things that we have had to do along the way, but by and large, she is healthy and thriving in her own special way. So despite the trauma of the diagnosis and then processing it through the pregnancy, we feel that, we came out on the other side of that, and that was the hardest time we've ever gone through as a family. So we are definitely full of compassion for those who receive a diagnosis like this. We know how devastating it is. And in fact, many in our community are processing this after having gone through infertility for a long time. I don't know if there's a connection there. It's far beyond my pay grade to even speculate on that. But you could imagine, people who desire a baby so much and then have a diagnosis. There are a lot of different circumstances, and no matter what the circumstances are, it is painful to be told that your child may not make it to birth.
Absolutely. Yeah. When it comes to, it's just incredible, your story. Maybe you can tell us just briefly, what is your organization? Why did you start the organization, and what is the mission?
Yes, thank you. So Verity's Village is a dream that was written on my heart in the days when she was tiny, and we were frankly in survival mode. We brought her home from the NICU, and in some ways kind of felt like, the world, we were very open about our journey. We blogged, we shared on social media. Again, we had much support. And so we were very open with what was going on in our family. And so when we brought her home, it seemed like a success story. She overcame the statistics, and here we are. But the reality is that we had medical equipment and boxes everywhere that I'm an English teacher. I had zero medical background. I'm very well versed now in some of this terminology that we use on a day-to-day basis, but I had machines. She had a feeding pump. We had to run to the emergency room when she would yank that NG out of her nose. And there were all kinds of things. And honestly, we lived in fear because we had been told that she was probably going to die in her first year. And so every day we were waking up wondering, is this the day that we're going to say goodbye? And we were being connected in support groups online and seeing these little ones and cheering them on, only to mourn their passing. And so it just was kind of, when is the other shoe going to drop? When is that going to happen for us? Mm-hmm. And so we made it to her first birthday, and then we kind of just breathed for the first time and started thinking, okay, instead of waiting for her to die, I think we just need to be prepared for her to live. And that's going to look a lot different than maybe we thought, having 8 healthy children and now this child with significant needs. And so really the first 2 years, I'd say, were so hard as we learned. We didn't know about her obstructive apnea. We didn't know about her severe reflux. And we had a hard time getting her to gain weight because she was vomiting so much. So there were a lot of critical things we had to address and just learn about Verity, what her needs were. And so in the meantime, we have toddlers, we have teenagers, and we have a marriage. There's a lot to juggle there. And I felt that if we, with all of our support systems, if we were struggling, I was facing depression and anxiety and panic attacks on the daily, if I had all the support medically, church, family, neighbors, what about the people who don't have a support system? What about those who are being told by their medical providers that you need to have an abortion, or, you just can't do it. This is too much for you. What about those, whose family members are not providing that support? And my heart just went out to these moms who I was seeing them come into the Trisomy support groups, and they were just devastated like I was. I could put myself back there immediately. My body would react the same way. When I got that phone call, I would have that feeling, and I knew what they were going through. And so I just started to see a little bit of a gap, because there are support groups for those who are caring for children with special needs, but I wasn't seeing a lot in the prenatal space of how can we walk alongside moms who are, probably just being filled with all the negative aspects of a diagnosis. And again, not that's not going to come to pass. There are it is life limiting, right? It's called that for a reason. But there's the other side of it. There's the side that what if your child does survive? And what if you find that that child is the biggest blessing you could have ever asked for, that you never would have imagined?
Absolutely.
What if we could, share the other side of that? And so Verity's Village was born out of that desire to help those moms. And we incorporated as a nonprofit after Save the Storks gave us a generous grant back in 2021. So we have officially been in ministry approaching 3 years now, and we do walk alongside moms and dads and families who receive the life-limiting diagnosis. And thank you, Dr. Wheeler, too, for mentioning that we prefer not to say it's a fatal diagnosis because we don't know. We choose to use that term life-limiting because it is limiting in some way. We don't know what that will look like, but we say that our vision is to change the narrative surrounding genetic anomalies from heartache to hope. And that's going to look different for every family because every story is unique.
I love that phrase. And I was just checking the website, and it's so inspirational. You can feel the love, the compassion, and what an incredible message through your organization, that there's a lot of hope, and that the families are not alone. That there's a lot of support, and specifically, for the families that are dealing with this situation. What a beautiful! It's just I can feel it. So you are such a blessing, and your organization, and just to help so many other families like that. And that brings me to my other wonderful guest, Deanne Wikler, and she's an OBGYN nurse with 40 years of experience. She's certified in her area of specialty, labor and delivery. She cares deeply about the health of women, babies, and the families they create, and has worked in a variety of settings to care for them. For almost 10 years now, she has served as a perinatal hospice family care coordinator. She has 3 grown children of her own, as well as 6 little grands. Welcome, Deanne. Thank you. It's such a pleasure to have you. Yeah. Would you please tell us what led you to that interest and to working at perinatal hospice?
So thank you for having me, first of all. It's very good to see you again. I went into nursing thinking that I wanted to go into obstetrics. I knew that that was going to be my love. And my thoughts at the time were butterflies and bunnies and happy endings. And I came to realize that that's not always the case with families, that there are losses sometimes and that there are difficult things. And as a young nurse, I saw some things that were not done well for families. And it just broke my heart for them. And so I started volunteering, asking to care for these families when they would come through labor and delivery, wanting to do something well for them and to do it so much better than I had seen done previously. So I became involved with more work to create some consistent, excellent care. I helped to develop a fetal loss committee at the hospital that I was working at. I served to start an annual remembrance service for families where we would do all sorts of things for them, just to recognize them and to let them know that they were seen. And so I continued to do this work for many, many years. And it was pretty much a professional calling for me, just a calling on my life to do this. And then in 2014, the narrative changed drastically for us, and it became a personal thing for me. And if I lose it here, forgive me. We're coming into a season that's difficult still, 10 years later. So our daughter was pregnant with her second child. They were living across the country, didn't have a huge support system with them, but an okay support system. She had her routine anatomy screening ultrasound, which initiated a whirlwind of specialists and testing and bad news and more bad news. The consensus from all of them was the same, that this baby girl was just gravely ill and that there would be no cure for her. Her baby girl had multiple severe life-limiting health challenges. And then came the devastation. By the time she had had the ultrasound, it was clear that this baby girl, our granddaughter, was already dying. Her daughter called me almost in a panic. I was at work that day and had to leave the floor. She didn't know what to do. She was being pressured. She was being told over and over and over by specialists that the most humane thing to do was terminate, that she would not be able to carry this baby. And she was being told this about a baby who still had life, who still had a beating heart, who had the spark and the light of life in her very visibly. So I knew from my own work that what my daughter was being told could be done differently, and that it could be done well, and that this baby's life could be honored and respected, and that our daughter did not have to follow the recommendations of the physician she was speaking with. So I talked with her, I talked with her husband, I talked with one of the specialists one evening. When he got off the phone, finishing his spiel, my daughter and her husband and I spoke, and we said, there's a way we can do this with respect, we can do it with compassion, we can do it lovingly, we can do it well. Given my personality, I immediately went into work mode. I started looking for resources for her on the other side of the country. I was not finding a whole lot available. And what I was finding did not seem to be of very high quality. I reached out to a friend of mine who had formed a perinatal hospice. That hospice has since gone on to become one of the premier models for perinatal hospice. And I asked my friend just to come alongside of us. And she was there to support us. I went out to the state my daughter was living in. I stayed for 6 weeks total. But just prior to my going, our granddaughter passed. And my daughter, I am so proud of her. She allowed this baby girl to live out her natural life. She did nothing to hasten the end of this baby's life. This baby passed, never knowing anything but the warmth of her mother's womb and the care and the love of both of her parents. On an icy, frigid morning, we went to the hospital for her to be delivered. And her father lovingly created a space for this baby girl to be welcomed into the world. And he created the most loving space for a wife that I have ever seen in my life. And that was my daughter, and that was my granddaughter that he did this for. And in the early morning hours of February 17th, 2014, Audrey Grace entered this world. She was in her own time. She was imperfect, and she was damaged by the standards of so many. But she was beautiful, and she was cherished, and she was loved beyond anything words could ever say. Audrey means noble strength. Grace is for the gift that we are given throughout our lives. So I continued my work with other families after this time, only it now shifted focus, and I went to work for the perinatal hospice that had given us so much support and love and care. And as a perinatal hospice nurse, I can truly say that I consider it to be one of the highest honors, one of the greatest privileges I could ever be given by God, to walk in these difficult spaces, in these journeys with this family for the short time that we are given with them. And I just say we comfort with the comfort with which we have been given. So.
Wow. I know part of your story, but yeah, it's just incredible. And I'm so grateful that you are sharing that with us, and the more people are going to hear about it. It's so moving and so caring, and there's so much love involved by allowing the natural course for the baby.
Absolutely.
So yeah, I appreciate so much. in my years working with a community, I noticed not too many people are aware of the special services that perinatal hospices can bring. And I know one particular case that it was a little bit like your precious granddaughter. One of my dear friends, her baby was diagnosed with trisomy 18, and the baby passed after, I think it was 10 minutes after it was delivered. But she told me that that was the first time that I've heard about perinatal hospices, and she used the services. And she told me it was such an incredible work of love of everyone in the hospice, and how they were allowed the transition of the parents, and even just taking pictures and holding the baby. And it was closure for her. Of course, they treasure those precious 10 minutes. But what would you say to the people that are not aware of the services of the perinatal hospice? What it specifically is, if you can tell us what kind of services, how they dealing with a family, parents that are dealing with a situation like that?
Well, so perinatal hospice is a model of care that exists to provide support for families who are journeying a life-limiting diagnosis. And we exist to bring some hope into an unimaginably difficult situation. We create space to recognize and honor the dignity of life. These families continue to parent their child, whether they're in utero. Parenting doesn't stop with the diagnosis, and parenting does not begin when a child is born. And so we offer and encourage and support in ways to do this parenting with children. The diagnosis typically occurs at around 20 weeks of pregnancy, with that ultrasound that everybody's so excited for. When the parents receive a diagnosis, they can self-refer to us, or they can have a physician refer them. And then at that point in time, these families are assigned to a family care coordinator, which has been my position working in perinatal hospice. And our goals are multiple. We allow and encourage families to experience and grieve the losses, because there are many. It's, yes, an anticipated loss of life, but there's the loss of what was expected with a pregnancy, and there's the loss of the hopes and the dreams for a child. And we also strive to create a space that makes the fearful things, the unknown things, less unknown, and to make them more known, and to make them more understandable, and take some of the power from that fear. And we work hard to create tangible memories, because when a child has passed, there's nothing else that remains. And it's only what we can do tangibly that these families have to hold on to. We sit alongside and we walk through with these families. And I would say one of the greatest gifts we offer is the gift of time. Time to journey, time to reflect, time to create, time to process, time to start the grief process without having to be hurried through it. And we do tons of different things, just a myriad of ideas of ways that we do these things. Sometimes it's a matter of accompanying a family to a physician's office appointment. Sometimes it's a matter of phone calls. Sometimes we meet at a coffee shop and just let someone talk and just sit in it with them. Sometimes we go for a walk and talk to the baby. And sometimes we record a mom reading a storybook. I mean, there's just a zillion different things that we do. All of them are driven by the family's personal needs. All of them are driven by the family's wishes. We offer, we never expect. But the goal is to create healthy families that come through on the other side of this journey, whole and healthy, physically, emotionally, and spiritually. It's always a walk between the very fine line of hope and grief. But we strive, it is our greatest desire to bring just glimmers of hope to an unimaginable situation.
You guys are amazing. What a blessing and honor to have you both as our guests. And for the doctors, like always, your expertise is highly appreciated. This is all these topics are so important, and just to keep talking, discussing, and having these incredible
Yes.
testimonies, because these are real cases. We have to be able to tell others, know that there are people that went through that, and there's hope, there's compassion, there's support groups. Is there anything else you guys would like to add? Maybe just to give us information about your organization, Beverly, and how to find it. And besides,
Yes.
I believe I have you too in the Life Decisions app is already there too, and also perinatal hospices. But you can just give us quickly information about the organization. That would be great.
I would love to. Thank you so much. And I love what Deanne is doing. We try to connect our parents with somebody locally that is doing what you're doing. Perinatal hospice is close to our hearts with your mission and just the many ways we've seen that help our parents. We serve all over the country. We actually serve all over the globe. We have a sweet mama in New Zealand who was just shared with me that her little girl lived 24 hours just passed. She's with Jesus now, but her parents are so grateful for those 24 hours, and they have been a testimony of carrying her when every doctor in New Zealand was telling them that they would never meet their little girl alive. And so, yes, we honor that life, however long or short. So we have a prenatal support group. We have a bereaved parents support group. We have books and journals that we send. We send gifts to babies as well. So veritysvillage.com. You can find us. If I would just say, if anyone is listening and knows someone who has a diagnosis, because it'll come across your path probably, refer them to a local perinatal hospice area. Verity's Village exists to help walk alongside these parents as well with some tangible resources. So we would love to send a package of books and gifts to mamas that are going through that.
Thank you. And do you want to add anything else?
So I would say some of what these parents are told is fear-mongering by the abortion lobby, by some physicians who would prefer not to carry a life to term. I've witnessed countless passings over the years, and I have never yet seen a passing that is not gentle. And so what these parents are being told is a twisting of the truth. I think these babies, if they survive, they are made comfortable. They are not left just to die gasping for air, as some of these parents are told will occur. And I would say that in every time I have been in a passing, be it an infant, be it a child, be it an adult, there is a sacredness to that time. Yes, it's painful. Yes, there is grief, but there is still the spark and light of life in that human being. And when that spark and life ends, when the last heartbeat has occurred, when the last breath has been taken, that child is at peace. That infant is not suffering. And so I feel parents need to hear that, so they're not so fearful for their child.
Absolutely. Thank you so much. And the doctors, you guys have any last comments? And would you like to add anything else?
I would just say that echo what Deanna said, is that frequently I hear of situations where families feel undue pressure to pursue abortion and told that's the main thing. And I think hopefully from this discussion, our audience has learned that that's not the case. In fact, abortion can be one of the most cruel ways to die of a poor innocent human being in utero, and that there's lots of us will walk along with these families, and that, as they have attested to it, celebrating that life rather than trying to forget it is psychologically much more important and much more helpful to the grieving process. So I think I just want to reiterate and commend the two of you for what you're doing.
Thank you.
Yeah, I would echo what Tom said. Being in the medical profession, and I'm horrified to say, having been one of the doctors who I didn't encourage people to have abortions in these situations, but I always, it was interesting in training. We talked about the moms and the babies until there was a serious anomaly. And I trained at a major genetics center at the University of Utah. And once there was a serious defect, it was always presented, and we pick up the way that we're trained. It was always presented as if you choose to continue. Like there was almost an assumption. It was never I never offered, but you have a choice here and you get to choose whether you want to go through this. But the baby was always disregarded. And for me to come out the other side of having been that person doing the abortion and just the horror of that, realizing that the babies incredibly suffer now that we really do know from the literature, they're aware, they feel this. We wouldn't do this to an animal, but we do this to our children in the guise of not suffering. And so, Deanne, I so greatly appreciate you saying, having gone through hospice with family members, it sounds so frightening until you're actually there, and it is sacred. And like you, I loved to take, as weird as it sounds, given my other history, I loved to step into that space with the people going through the really hard deliveries whose babies had already passed. And there was something about making that life matter. And so I really appreciate this conversation of bringing it back to just how valuable and beautiful this life is, and to not be afraid of what you're about to face, but to embrace the life of this child.
Right. Well, thank you again. It's been an honor and a pleasure just to have all of you and for the podcast. And our hope is that more people can have a good understanding of the resources that we have in the state, and even like you were mentioning, Beverly, and even internationally. So join us next time. It's every Wednesday at 7 o'clock. We are going to try to have different guests and discuss different topics regarding this important issue. So find us at lifedecisions.me. So we are going to be posting the podcast so you can have access to it anytime you want. So thank you so much. Have a wonderful night. Bye-bye.